So vaccines are starting to roll out, and so inevitably we start hearing about people who refuse to be vaccinated. And I'm going to tell you why you shouldn't be too harsh on the anti-vaccinators and why you shouldn't be too congratulatory to the vaccine makers. Why I'm negative about positive
Back to the story, because I've got a story. So I've got some top tips on
It tells you to think critically. It helps people like me stop doing stupid things. So as the world moved into 2021, there was hope that this was going to be a better year than 2020, with most of that hope being pinned on the development of a number of COVID vaccines. Right now, it's not yet clear how well the rollout of the vaccines will be. Doesn't look like it's working out great in the US and UK. It's looking like the rich industrial nations are buying up all the vaccines for themselves and leaving little or nothing for the poor nations. Oh, and if that continues, it's not just morally reprehensible, but it'll put the prospects of overcoming the pandemic in complete jeopardy, as none of us are safe until we're all safe. We're also getting early signs of those who are refusing to get vaccinated, and they're likely to be pilloried as selfish and stupid. But we need to pause for thought before we condemn them and ask why they don't trust vaccines, and do they have grounds for that distrust? Well, a way into that question is to look at some of those people who are first in line for the vaccine, who might be the first to refuse. And these are those classed as vulnerable, either due to their physical age or due to their having pre-existing health conditions. Now, a large number of those in that latter group are black people, because many black people have been pushed into poverty and kept there by an economic system that is structurally racist, and poverty is a major contributor to ill health. Now, do black people have a reason to distrust drug companies? Well, yes, some of them do, because black people have been used as guinea pigs in illegal drug trials by the very pharmaceutical companies that have developed the COVID vaccine. So drug companies like Pfizer have been sued for illegally trialling drugs in Africa. One of the most infamous cases was in the Kano state in Nigeria in 1996, which was the epicenter of a meningitis outbreak in that country. Pfizer illegally tested their drug on children to see if it was safe.
The last hurdle of a decade-long compensation claim battle. 17-year-old Shamsu undergoes a DNA test to prove he's a victim of a failed drug trial by the pharmaceutical company Pfizer that happened 15 years ago in Kano State, Nigeria. 11 children were killed and several more injured when Pfizer tested out a drug called Trovan on 200 children. The drug was supposed to treat a deadly regional outbreak of meningitis.
Once the scandal of the Pfizer vaccine was reported in Africa, many parents in Africa refused to have their children vaccinated with other drugs, even ones that have been shown to be effective and safe. And this was one of the major contributors to the outbreak of polio in parts of Africa in 2011. Now, these scandals have also occurred elsewhere, notably illegal drug trials conducted on the poor in India.
Over 250 of them were put through drug trials without their knowledge or consent. 10 even died after being treated like guinea pigs by these pharma companies. Mawar Chaudhary has more.
279 people were illegally tested for new drugs without their knowledge or consent at the Bhopal Memorial Hospital and Research Center in Bhopal, one of the several violations that took place while conducting 10 clinical trials at the hospital.
Also, Africa has been used for what has been described as medical colonization by the drug industry, where blood samples and other biological samples have been taken from people without their consent and used by drug companies in their medical research. And there's plenty of reason, if you're black, to be suspicious of the activities of drug companies. If you aren't aware of all of this stuff, go watch the movie The Constant Gardener. It's a great movie and it's all about this kind of stuff.
There's a TB epidemic coming. It will affect the entire world. Billions and billions of dollars are waiting to be earned.
Big pharmaceuticals are right up there with the arms dealers.
Payoffs, cover-ups, unmarked graves.
Are you crazy? These people, they kill anybody.
The poor man seems to have convinced himself there was a conspiracy in which we are all complicit.
There's a contract out on it. You'll never know who ordered the hit. But that's the way it works with corporate murder.
It's well worth watching. But these are not the only reasons for the distrust. It goes far deeper and wider than illegal drug trials in Africa and India. Other scandals include drug companies promoting the off-label use of their drugs and paying illegal kickbacks to doctors. Off-label use is where a doctor can prescribe a drug to a patient for a condition the drug isn't licensed for, and the doctor would do this if they're persuaded that the drug was effective for that condition. The problem is that drug companies have been persuading doctors to use drugs off-label when the drug company's own research shows that such off-label use for a particular drug is either unwarranted or dangerous. And the kickbacks are where drug companies influence doctors' prescribing practices by giving them some form of financial incentive. This can be direct payments or gifts and so on to encourage doctors to prescribe a drug to more patients for longer periods of time or in higher dosages, to the point at which such prescribing practices become dangerous, sometimes lethal for the patients. Now, these are big claims I'm making. How do you know what I'm saying is true? Well, the evidence is mostly judicial evidence provided in courts in legal cases that have been successfully prosecuted. And these facts have been established through successful litigation against companies like GSK, GlaxoSmithKline, for illegally promoting the use of antidepressants in mental health, pediatric mental health with children, even though GSK knew those drugs to be ineffective and unsafe for use with children. And GSK was fined $3 billion for that, and for not providing safety data for Avandia, which was an anti-diabetic drug, and making false claims about the safety of Paxil and Wellbutrin. These are antidepressant drugs. GSK were also fined $750 million in 2010 for poor manufacturing practices. What's this got to do with COVID vaccines? Well, GSK are actively working on a COVID vaccine, and other companies involved in developing a COVID vaccine have also a record of illegal practices. So we're talking about AstraZeneca, Pfizer, Merck, and Johnson & Johnson. And here's some of the examples of litigation from the US. This is just a snapshot, and only from the US. So AstraZeneca, in 2010, they paid out a settlement of 520 million, these are big numbers, there are bigger ones coming, $520 million for unsafe off-label promotion of its drugs and for giving doctors illegal kickbacks. And previously in 2003, AstraZeneca was fined $355 million for engaging in fraud of the US Medicare system. Pfizer, in 2009, had to pay out $2.3 billion. I told you there are big numbers coming. $2.3 billion in a settlement when it was found to have engaged in illegal off-label promotion and illegal kickbacks to doctors. 5 years earlier, in 2004, it paid out a $430 million settlement for illegal off-label promotion of its drugs. Merck, in 2008, paid a settlement of $650 million when it was found to have engaged in Medicare fraud and paying out illegal kickbacks. And Johnson & Johnson in 2013 paid out a settlement of $2.2 billion for illegal off-label promotion and paying physicians kickbacks. Now, there are a host of other pharmaceutical companies that have similarly engaged in such corruption and illegal practice that have put public health at risk, but I've just focused on those companies whose names are being tallied around as heroes in relation to developing a COVID vaccine. Now, I'm not saying don't get a vaccination. Vaccinations do work. Please get vaccinated. This COVID stuff is serious. We're all going to be in a hell of a lot of trouble, or more trouble, if people don't get vaccinated. But just don't put these companies on a pedestal. They're not model actors. And don't be shocked if people don't trust these companies. These drug companies have given many of us plenty reason not to trust them. Right now, we're in such a mess with the pandemic that we have to trust that these drug companies are going to act legally and put public health before profit. And there's some reason to believe that they will, given how much attention is focused on them just now. You know, if they engage in corrupt practices around the vaccines, and if they promote unsafe vaccines, it will be discovered, and the backlash will be enormous. There will be trillion-dollar, not billion-dollar lawsuits, and it could signal the end of some of these big companies. So just bear that in mind when thinking about the anti-vaccinators. Yes, we need to persuade them to get vaccinated, But we need to understand where some of them are coming from. Some might just be acting in bad faith, some might be acting out of ignorance, or they've been sucked into one of those right-wing cults. But we need to recognise there's good reason for some to be fearful, given some of what we know about what those big drug companies have been up to in the recent past. Okay, that's the end of my rant. Until next time, or next rant, or next sweat out. It's like I'm doing this in a sauna. Anyway, till next time. Ta-da.